Good morning. This is Dr. McDaniel. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me at the corner today. Let's see, before I get started, I'll say please check out the YouTube channel. It's also called GYN Corner, and the podcast, also called GYN Corner. This is always going first and foremost to the Facebook page, GYN Corner. Now, at the last presentation, I spoke about there are no guarantees in pregnancy. So I had a patient who wanted me to basically guarantee that the pregnancy test was positive, that pregnancy was going to be a normal pregnancy for her because she had suffered a miscarriage 2 months prior. I think it was 2 months, like a month and a half or something prior. And we did a pregnancy test because she hadn't had a cycle since the miscarriage, and it was positive. So please refer to the previous presentation. It's part 1 on pregnancy guarantees. This is part 2. So the upshot from the previous presentation was basically there aren't any guarantees. What we do is we do the urine pregnancy test. If that's positive, then we do the blood, and the blood pregnancy test is a serum quantitative HCG, or human chorionic gonadotropin. That number, when the blood test comes back, gives us a ballpark figure about how far along the pregnancy should be based on the hormone number, but it doesn't tell us exactly how far along the pregnancy is because the range is extremely broad, so we just use the minimum. If that number looks appropriate for how far along we're saying she is based on the last menstrual cycle, if there's a question about whether or not it's a miscarriage or not, then we'll just repeat that number in 2 to 3 days ideally, and it should have a reasonable increase if the pregnancy is growing normally. And that increase should be about doubled every 2 to 3 days. Now, the blood pregnancy hormone, that pregnancy hormone comes from that immature placenta, which we call the chorionic villus. So it comes from the immature placenta, doesn't actually come from the pregnancy or from the baby, the fetus itself. So on occasion, it will be a miscarriage. The fetus has stopped growing. It's no longer growing, it's over. But that placenta continues to grow a little bit. So every once in a while, the hormone will continue to rise, but it won't rise appropriately as with a healthy, robust pregnancy. It'll just kind of whimper along. So if that hormone number is at a minimum level, which would be around 1100 to 1200, at the outside 1500, we should definitely see an intrauterine pregnancy, and we should see that it looks appropriate for how far along we're saying she is based on her menstrual cycle. If we don't see an intrauterine pregnancy and it's above 1500, then it's either a miscarriage, it's not going to reveal itself to be a normal pregnancy, or it's potentially an ectopic. And I have a previous presentation that discusses ectopics. Now, if there's an obvious intrauterine pregnancy, but it's not correlating to how far along it should be based on our menstrual cycle, then we will repeat that pregnancy hormone number in the 2 to 3 days, as I said, and then we'll also repeat the ultrasound in a week if it's a desired, if it's a wanted pregnancy, because in a week we should definitely see increase in the pregnancy according to how far along she's supposed to be. So if she's supposed to be 6.5 weeks, we repeat it in a week, and it's measuring at 7.5 weeks or 8 weeks, then it looks good. And of course, we should see a heart beating at 6.5 weeks, as I mentioned on the previous presentation. If it's 6.5 weeks according to the menstrual dating, it's appropriate for 6.5 weeks on the blood work, but there isn't a heart beating, it's measuring 6 or 6.5 weeks, there isn't a heart beating, then you don't really need to repeat the blood test again because it's already proven it's appropriate for how far along she should be. You just need to repeat the sonogram either in a half a week or a week. Definitely you should see the heart beating. If you don't see the heart beating, it still looks like a week later, it's only 6 weeks, then you're going to need to call it it's arrested, it's a miscarriage, and it's what we call a spontaneous abortion. So it's a medical I'm sorry, I don't want to say medical abortion because that's another time, but it's a spontaneous abortion. So Mother Nature has aborted the pregnancy. It's arrested at 6 weeks. It's not going to grow any further. It's over. And then what we do, if the pregnancy is under 7.5, sometimes up to 8 weeks, but definitely under 7.5 weeks, you don't need to do a clean out, a scraping, a suction D&C to eliminate the pregnancy from the uterus unless the patient's just upset, she just wants it out. You can allow your body to pass it naturally. So what we do is we just follow the hormones until the hormones go all the way down to 0. And then depending on where the hormone level is, she'll start seeing bleeding and cramping. It'll crescendo and then it'll just drop off like a faucet being turned off. And all of that, depending on where that hormone number started with, should all take place within 1 to 5 weeks. So for some people, it will be quite a while, especially if she just came in for what we call a dates and viability sono. She just came in to confirm everything was normal, and then surprise, everything's not normal, it's a miscarriage. Then, and she hasn't had any cramping, she hasn't had any spotting, bleeding, nothing. The hormone looks like she probably just miscarried within a day or two of the sono. Then it might take 3 or 4 weeks for her to start seeing cramping and bleeding. It's unpredictable. So I'm gonna kind of wind it up now since I'm trying to keep my under 8 minutes. So this is part 2 on no guarantees in pregnancy, and the upshot is if the hormones are lining up correctly, the sono's lining up correctly, and you don't see a heartbeat after 6.5 weeks, but it's definitely a pregnancy in the uterus, then it's over. You can hold out 1 more week, do a repeat sonogram in a week to see if maybe you just didn't pick up the heartbeat. But if it's still not where it's supposed to be, a week after that initial sono that showed it should have been a heartbeat, it's over. You can allow things to progress naturally on their own, which is what we usually recommend, or you can intervene, do a suction D&C, and it's over. So I hope that's been helpful information on miscarriage. Spontaneous abortion is what we medically call a miscarriage. If it's no abortion where someone just doesn't want the pregnancy, we call that a therapeutic abortion. And that can be done either medically or surgically. And I'll have another presentation touching on that topic and the difference between those two. So I hope that's been helpful information. Have a great rest of your day. If you appreciate the information, please hit the like, subscribe, follow buttons, and thank you.